Hello, and welcome to our first episode of Wellness Wednesday with Dr. Latoya Wells in the month of September 2024. I am Dr. Latoya Wells, Doctor of Nursing Practice, family nurse practitioner, owner of Wells Legacy Health and Wellness. We are a full service primary care office where we see all ages, right? We provide all things primary care. So if you are in need of a primary care provider, please look us up. If you're just not feeling well and not sure what to do or where to go, give us a call and we'll help you navigate what you need to do next and make sure that you get the care that you need. If you're someone who is in need of CPR training, certification, we provide that as well. Our team is ready to help you. We provide care in a convenient way that is individualized to you. So care that makes sense for you, right? So if you are someone who needs care, health care, you haven't seen a doctor in a while, you haven't seen a primary care provider in a while, you haven't had a physical in a while, something's going on, just doesn't seem right within your body, contact us and we can help you. We're located at 452 Osceola Street, Suite 106 and 107 in Altamont Springs, Florida. Our number is 321-306-6755. You can find us on social media on all the platforms. We're live every Wednesday. You can catch all of our live recordings on demand on our YouTube page. You can also reach us on our website, which is where you can make an appointment or you can call us to make an appointment as well. That's wellslegacyhealthandwellness.com. So there's my advertisement. Let's jump into it. Tonight we're going to be discussing lupus. I knew that lupus was prevalent, right? But I didn't know it was this prevalent. Meaning 1.5 million Americans are currently living with lupus. That's astounding. That's a lot of individuals who are living with this condition. There are a certain group of individuals who are at a higher risk for being diagnosed with lupus than others, and that's women. Women are have a higher incidence of being diagnosed with lupus than any other gender than their male counterparts. When we look at the time frame for which these women receive their diagnosis is between the age of 15 and 44. So we're speaking of adolescents being diagnosed with lupus, young adult women being diagnosed with lupus, middle-aged women being diagnosed with lupus. And so let's just make sure that we're giving grace because we just don't know what people are dealing with. On any given day, we don't know what an individual is dealing with. So let's make sure that we are extending grace. When we look at different populations who are at a higher prevalence for being diagnosed with lupus or to be living with lupus, we have the African American community, we have those who are of Asian descent, we have those who are of Hispanic descent, and then those who are of Native American descent who have a higher prevalence of being diagnosed and are living with lupus. Lupus in and of itself is a chronic autoimmune disorder in which the immune system begins to attack itself, the healthy tissue, so causing inflammation and damage. And when I think about lupus, I think about the old game that we used to listen to or play. There's an old game that we used to play, and I'm going to date myself now. It's called Pac-Man. And when I was younger, we would play Pac-Man, and you had the big Pac-Man, which was like the little Pac-Man that would go after the ghost and go after the little dots to get energy. And when I think about lupus or any type of autoimmune disorder where the body in and of itself is attacking itself or turning on itself, I think about the Pac-Man because the immune system begins to attack the different cells. And so with lupus, the healthy tissues are being attacked and it's causing inflammation and damage to those cells or those tissues. When we speak of tissue and different organs, there are certain organs that are more prevalent or more prone to being attacked by lupus, and that's the skin, the joints, the kidneys, the heart, and the lungs. We're going to delve into some different types of lupus because there's several different types of lupus. The first one, which is the most common type of lupus, is the initials for it is SLE, systemic lupus erythematosus. I mess this up all the time. Erythematosus. All right, erythematosis. So systemic lupus erythematosis, or SLE, is the most common form. And with this form, there's multiple organs that are affected, right? So the immune system begins to affect the organs, but there's multiple organs that are being impacted by the damage from the immune system, the inflammation, which then causes damage. The next form is discoid lupus erythematosus, or DLE. This one primarily affects the skin, causes rashes and different lesions on the skin. The second one that's really common is subacute cutaneous lupus, or SCLE, which is subacute cutaneous lupus erythematosus, right? And this one causes skin rashes that appear as the skin is being exposed to sun. And then there's also drug-induced lupus. So this one is triggered by certain medications and typically resolves when that medication is stopped or withdrawn. So there's several different types, but we just talked about 4 of the common types of lupus. Now we also have neonatal lupus, which is rare, and this one affects newborn and is often due to antibodies that's passed from that mom who has lupus to the baby. And so we can see that one, but it's very, very, very rare. So we just talked about 5 different types of lupus. One that's most common is SLE, which is the systemic lupus erythematosus, right? And that's the one that we see most commonly. But again, those other ones can be seen. I just want you guys to know, because there's many different ones that we need to be aware of. So when we're looking at lupus and we're looking at the signs and symptoms and we are trying to figure out, okay, how do we diagnose someone with lupus? As many of you know, usually there's a physical exam, and if you haven't had your physical yet, you still have time before the end of this year. We're in September, October, November, December. You have almost 4 months left to get your annual physical exam done. If you haven't had your pap smear women, if you haven't had your prostate check men, if you have not had your mammogram, or all of those preventative screenings, it's time, and you still have time to get those things done. So, okay, that's my little soapbox again. So with lupus, in order to diagnose it, there's certain blood tests that we can do. So we're going to do a physical exam, right, to examine that individual. And we may find different things during the exam that may lead us to, okay, say this individual may have lupus. But blood work is going to be one of the diagnostic techniques that's going to give us a pretty definitive diagnosis of lupus. And so what we'll do is we'll run a test called the ANA test. And this one is deals with inflammation. It's going to tell us inflammatory markers in the body. When someone has lupus, that those levels are going to be elevated. We're going to look at the urine. There's be some imaging testing. And if there's any lesions and things of that nature, we may be doing some biopsies of that tissue to kind of send it off to see what's going on. We want to make sure that being evaluated by your healthcare provider, whether it be your primary care provider or what have you, is important. But if we have an individual that we are suspecting that they may have lupus, we're going to send them to a specialist, which is called a rheumatologist, to make sure that they follow this individual, and then they're going to provide the ongoing care for that individual. Not to say that the primary care can't, and if they specialize in lupus, or if they have that training, then they can. However, there are specialists for a reason. And so for me personally, if I have a patient that I am suspecting that they have lupus, I will start the initial workup for them. And then what I will do is I will then send them over to a rheumatologist to manage their lupus. So it's important, right, that we do that physical exam. We try and figure out what's going on. It is important to note that lupus, some of the symptoms of lupus could mimic some other conditions. So it's important that we do these specific blood tests, these specific diagnostic tests that will help us to rule out lupus versus something else. Some of the signs and symptoms of lupus, and you'll understand now that a lot of them may mimic some other conditions or just general being tired and fatigued, right? You're just overworked, you're tired, you need to get some rest, you need to take a break and relax. And you just may be tired and fatigued. You may have anemia and maybe feel fatigued. But some of the signs and symptoms of lupus can mimic other conditions. So some of the most common signs and symptoms of lupus is fatigue, joint pain, muscle pain, and skin rashes. There's many other conditions that may present with the same thing. So it's important that as a healthcare provider that we know exactly what tests and what diagnostic tests to perform to help rule out what's going on or figure out what's going on with this patient. When individuals have a flare, so there's times where individuals with lupus have no symptoms at all. And then there's times where they may have flare-ups, whether it be after stress, whether it be after an illness or some type of injury, they may have a flare-up. And what those flare-ups look like, or what it may include, is fever, swollen glands, and weight loss. Organ-specific symptoms such as kidney problems, which can be lupus nephritis, which is inflammation of the kidneys from lupus. Lupus is essentially attacking the kidneys. Their immune system is attacking the kidneys. It sees it as a foreign agent or a foreign body. And so it begins to attack the kidneys. And this individual can begin to have issues with their kidneys. Chest pain, respiratory issues, right? So there are many different body symptoms that can be involved with lupus and when an individual has a lupus flare. When we speak about other body systems that can be impacted by lupus, we have the musculoskeletal system. So our muscles, our joints. So you have the joint pain and then arthritis that can be directly related to lupus and a lupus flare-up. Individuals who have the discoid type lupus or even regular lupus, you may see some rashes or skin sensitivity because of it. When we're speaking of the kidneys, which I just mentioned, individuals with lupus can develop something called lupus nephritis. With the kidneys, there's inflammation and there's dysfunction. So the kidneys are not functioning the way in which they're supposed to. And if you've been with me for a while, you know the kidneys are considered to be one of the filters of the body. It filters out some of the toxins and all of the waste products. And what we have is our urine that comes through, right? And so with lupus, when it's impacting the kidneys, it could also be impacting that individual's ability to urinate or for the kidneys to actually filter the way in which they should. When it comes to the heart, it places these individuals at a higher risk for developing pericarditis, which is inflammation of the lining of the heart, the pericardium of the heart, or it puts them at risk for developing heart disease. When we speak of neurologic system, as I mentioned, there's many different systems within the body that are impacted or can be impacted by lupus. When we speak of neurological system, individuals with lupus tend to have headaches, they can have mood changes, they can have cognitive issues such as difficulty remembering things, signs and symptoms, shaking, things of that nature. Some individuals I've seen with lupus have mimicked individuals who have like dementia or Alzheimer's because it's impacting their memory. And it's all because of the inflammation and damage to the brain or the neurological system. When we talk about treatment, it's going to be specific to whatever the symptoms or the body system that this individual is experiencing or being attacked by lupus. So one of the things is anti-inflammatory medications or pain medications to kind of help with the inflammation. We will have another one is the hydrochloroquine is one of the most common medications that could be used to treat lupus. And I don't know if you remember, but when COVID was at its highest, hydrochloroquine was used to treat individuals with COVID, and it's also considered to be an anti-malarial medication, but it is good to help with and there's a lot going on. I got pings going on here because the weather, and I have people checking to make sure that we're okay. but we are doing fine. So the different medications that individuals can take to or be given to help manage the symptoms of lupus. Corticosteroids or steroids can be used to help with reducing the inflammation and helping to reduce the immune response. So whenever someone has a large amount of inflammation within the body, let's just say you were to fall and sprain something or hurt something, a lot of times you can be given an IV IM dose of a steroid, Solumadrol or what have you, that helps decrease the inflammation within that area, or systemically if there's something going on systemically, such as with lupus. Lifestyle modifications. As I mentioned earlier, individuals with lupus can live and not have any flare-ups and live pretty healthy lives. However, individuals who have a flare-up, they may need some assistance. And so working on stress relief and decreasing the cortisol levels, making sure that you're getting regular exercise. I have a friend who has lupus, and one of the things that she says really helps her is making sure that she's staying active and that she's moving her body daily and that she's doing things to help her manage her stress. And exercise is one of the ways that she manages her stress. And then we all know eating the balanced diet. We talk about this all the time. Eating the rainbow when you're looking at your plate. You should have different color foods from different food groups on your plate, healthy options on your plate. It's not just something that we throw out there just to be thrown out there, but it definitely does help. Support system, making sure that you have support from others around you, joining help other support groups with individuals who have lupus. There's so many different. One thing I love about social media is that there are so many groups on social media: Facebook, Instagram, TikTok. You can go on and find the side of TikTok, for individuals who are living with living with lupus, who are involved in the social media platforms. And many individuals are very open and honest and transparent about their journey with lupus. I went on there and searched lupus just to kind of see what was available. And there's so many different things available. So many people who are very open and honest, like brutally honest about what's going on with them. And again, you got to be careful because not everything that you hear on social media is good for you. But I do believe that there's a community that individuals can join together where they don't feel by themselves. Sometimes having a chronic condition or, a chronic diagnosis can feel lonely, and these individuals can feel like they're isolated. But if they're able to join with other individuals who are going through some of the same things that they are, it can be helpful. So that's where that social network is there, whether it be locally or virtually. Social networking and joining a group of people can definitely be helpful, especially mentally, right? And if these individuals are doing all the things to help decrease the flare-ups, then you can join in with them and do the same thing. I've seen groups on social media who are lupus warriors, right? They are individuals who are living with lupus and who are battling lupus, but are making the most of their days and doing things that are enjoyable for them. And they share tips and things that they've gone through and things that have worked for them. And again, you have to be careful and make sure you do your due diligence to make sure you're researching what information is out there, but find things that work for you. If you are a family member of someone who's living with lupus, there's support groups out there for you as well, because a chronic condition doesn't just impact that one individual. It impacts everyone around them. And so if their village is there supporting them, their village may need support as well. So it's important that you are not isolating yourself. And if you are someone with lupus who has been isolating themselves, come out, get involved, reach out. There's help. There's someone there. And if you're someone locally who is battling lupus and you just don't know what to do, reach out to me. I will walk you through the process of making sure that you're getting the care that you need to get, whether it be from my clinic, from my staff, or some of the resources that we have access to, or some of the network individuals within our network, rheumatologists, other providers, holistic providers, wellness providers who can help you on this journey. So, how are individuals with lupus managing? They're going to their appointments, they're making sure that they're staying up to date with blood work and routine tests that are being ordered by their providers. They're learning about lupus. They're figuring out what life looks like for them with lupus and what are some things that they can do? What are things that they can change within their diet? What are some things that they may want to get involved in that can help them figure out what their life is going to look like after a diagnosis with lupus? Educating yourself, making sure you're getting rest and managing stress. As we mentioned, stress can cause a myriad of different issues within the body. Our bodies were not created for long-term stress. And so if you're someone who has lupus and you're struggling with being stressed, reach out. Let us talk to you. We have patient advocates who can help walk you through and just kind of talk you through some things to help you navigate your thoughts and feelings around what's going on. Making sure that you're prioritizing yourself. As I mentioned, self-care is so important. Communicate. Make sure that you're maintaining open communication with your healthcare team and your loved ones. Again, having a chronic condition can feel lonely, and many individuals will kind of withdraw and isolate themselves because I've heard this. I don't want to be a burden. I don't want anyone to have pity, feel pitiful, that I'm pitiful, or to offer pity or to feel sorry for me. We're here to support each other. It takes a village, right? We've heard that. It takes a village to raise a child. It takes a village to be there to support each other. And I'm grateful for my sister circles. I'm grateful for my circle of friends. And I have different groups of friends that provide me with different things. And I'm grateful for that. So if I need something, I have individuals that I can go to and just say, hey, listen, today's not a good day. I just need y'all to help talk me off the ledge, or I need your help, talk me off this couch so I can go and work out. But if I'm feeling a certain kind of way and I'm feeling down or I'm not feeling well and I just need to pick me up, I have individuals that I can go to, right? I have someone who they're going to listen to me and they're going to encourage me, right? I have someone that's going to pray with me. I have someone who's going to tell me, get off my butt and go do what needs to be done. Um, so we all have individuals in our lives who are there to support us in whatever ways that we need. So it's important, whether you're dealing with lupus or you're dealing with any other autoimmune disorder, that you're not isolating yourself and that you're reaching out for help and that you are staying connected to those that are closest to you. We talked about mental health previously, and I believe in September, I have to go back and take a look at my list, but September is also Mental Health Awareness Month. And so we have to be mindful of our mental health. And being an individual who's been diagnosed with a mental health disorder, right there is one of the ways that we need to, one, make sure that we're prioritizing mental health, right? Making sure you know where you are. There's something that I've seen in corporate America, and it's the mood elevator. And where we want to be is like right in the middle, which is curious. If you're too high or you're too low, anything can happen to cause you to and knock you off course, right? But if you just remain curious and remain open to receiving feedback, receiving help, receiving the encouragement, right? Receiving the support, then you're better. You can be a better person. You can better deal with what you're going through versus it's hard to receive encouragement when you're really low. And when your head's in the cloud, you don't really see things for what they are. So it's important to get connected to others who can support you and others who are either gone through what you're going through or are going through it right now or have gone through what you're going through right now. So what do I want to say in terms of support? If you're someone that's listening to this live or on demand, or you know someone who has lupus, share this with them so that they know that there's help out there for them. And typically, we have individuals, primarily younger adults, who, I don't know, there's certain generations where they just like, oh, whatever. It's just whatever, and don't really take things seriously. We have to make sure that we're taking our health seriously. For individuals who have lupus, chances are you have a team of healthcare professionals that's working with you, that's helping you walk this journey of being a lupus survivor and a lupus warrior. Follow their advice. However, there are some holistic treatments that are out there and different things that can be done outside of traditional medicine. I can't tell you what to do with your body. I can just say be educated, right? Look at all of the resources that you have and integrate some of the things. You may be able to integrate some of the holistic treatments into your traditional treatments from your rheumatologist and your other team that's there caring for you. Ultimately, we just want you to live a healthy life and make sure that you have the information that you need to be able to advocate for yourself and create a legacy of good health for many generations to come. We're going to go ahead and end. I'm going to go ahead and end tonight, but I just want to say, take care of yourselves. Do what you need to do to manage your stress. Do what you need to do to make sure you're taking care of these bodies. And ultimately, do what you need to do for you, your mental health, your peace of mind, whatever you want to call it. But just make sure that you're taking care of yourself. And if you are suffering from depression, anxiety, any type of mental health disorder, if you're having suicidal thoughts, reach out. You're not alone. There's someone here that is waiting to talk to you. There's someone out there who's going through the same thing that you're going through and wants you to know that you are not alone and that there's someone out there for you. So we're going to end. I just want to say thank you all so much for watching another episode of Wellness Wednesday with Dr. Latoya Wells. It's been a pleasure to come and bring you these Wellness Wednesdays each and every Wednesday, each and every week. There will be some weeks coming up that I will not be live, but I will let you all know. There will be some additional resources available for you all. So with that, stay safe and be well. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. Until next time, take care.